Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Examples of nephrotic syndrome. The main examples of nephrotic syndrome are minimal change disease, membranous glomerulonephropathy, focal segmental glomerulosclerosis. These three are the examples of nephrotic syndrome. Then, in the systemic diseases, the examples of nephrotic syndrome include diabetes nephropathy and amyloidosis are the examples of nephrotic syndrome. Then, examples of nephritic syndrome. The diseases which are involved in nephritic syndrome are post-infectious, IgA nephropathy, anti-neutrophilic cytoplasmic antibody associated glomerulopathy, anti-glomerular basement membrane, good pastures syndrome, or membranoproliferative glomerulonephritis. So these are the main causes of nephritic syndrome. The most commons are important. Most common cause of nephrotic syndrome in children is minimal change disease. Most common primary cause of nephrotic syndrome in adults, it is focal segmental glomerulosclerosis. Most common systemic cause of nephrotic syndrome is diabetes mellitus. So overall, the most common cause of proteinuria is diabetes mellitus. Then most common causes of nephritic syndrome in adults is IgA nephropathy. Most common cause of nephritic syndrome in children, it is post streptococcal glomerulonephritis.
thank you and thank you for watching.